Some of these questions pertain to filtration of the kidneys. I filter without all raw. Why, hope so. You don't need to be all raw to filter, and you don't want to be all raw to filter. But it takes all raw sometimes to get yourself to filter. You know, what you're doing is reducing the swelling in the kidneys, getting the adrenals up so the sodium-potassium balances are accurate, and basically getting yourself hydrated even in the kidney and the lymphatic tissues and the lymph nodes to the kidneys. Remember, kidneys and bladder have lymph nodes to them as well. So you want to filter always, or as much as you can. There's sometimes you look, it doesn't look like you're filtering much, and I suppose that's the ebbs and tides of. Don't get too caught up in it. You know, you can get too locked up in filtration too. And here's a person why says you do, because you are not filtering lymph, you are filtering the cooked food you ate. Now, all these foods are broken down. You know, you get rid of any digestive waste through the pooperino, but anything you pee out is going to be metabolitic waste. And you're going to have metabolitic waste from cooked food, raw food, from all foods. Even from meats and dead animals and all that. You've got a lot of waste that come from these things as well. So you want to filter no matter what you eat, cooked, raw, or whatever. It just takes a lot sometimes for someone to get filtering. It takes hydration. And hydration and energy comes from the living foods. And sometimes eating living foods, you stop the filter for some reason, but there's always some degree of filtration. When there's not, your creatinine levels are pretty high and you're headed for dialysis because your blood's getting the kickback a little bit. So I disagree with that one. You never filter stagnant lymph without all raw or fruit. I disagree with that. You should filter eating anything. But to get yourself to filter, some people are so inflamed in the kidneys and so genetically weak that they have to enhance the consciousness of the cells of the kidneys. They have to hydrate the lymph fluids because they're so agglomerated that they don't move well. And even in the kidneys, swelling and that sort of thing take place. And so filtration. And I'm sure there's a lot more to that. And we will learn as time goes on about more of that. I only know so much, and who knows? There can be a lot more role that the adrenal glands play in that. And does the pituitary play any role in the filtration issues of the body? They control the adrenals, which sit on top, and of course that definitely has some control power there. And of course low steroids, especially your alkaline steroids, can create more of an acidic hit as well. So the adrenals play a big role in a lot of things. How do you know you're filtering lymph? You always filter lymph. You can't filter foods out of the urine. Now your urine is totally tied to blood and lymph. It's also tied to the colon, no question about it. The absorption of water out of the colon is well known back into the body to make your stool firm, so you can pass a little more firm stool and you're not always liquid. You notice a lot of people have to pee after they have stool. When you go raw, mostly fruit for 2 weeks, then check fruit are easy to digest, isn't hard on the body, so it can focus on cleaning and loosening stagnant waste, and that's true. Fruits are astringent. That's why you see a little more filtration with astringent fruits. Because of this, you have the astringent side is more the pulling and drawing side of life there. So absolutely, you know. And of course, more electrolyte-rich foods are going to hydrate the body. Alkaline ash foods hydrate the body. But you can have alkaline ash foods like your cooked vegetables, but they're not as hydrating because when you cook, you bond. So it does move things closer to the acid side of the scale. It's like when you cook your foods, all your water solubles are pretty much dissipated. So your B vitamins, your flavonoid complexes can dissipate. Your lipids are bond with your proteins, and proteins bond, and so, you know, you get some bonding of nutrients too, which is, you know, not so good either. So you lose your electricity and you lose your more of your alkaline principles when you cook. That's why raw is so energetic, because you don't lose the electromagnetic energy. Your electrical bonds are present, so your magnetism is present, and it just energizes and enhances, and then the consciousness of the plant is present. So that also has to be looked at. You know, the mental part of the plant bonds with your mind. The emotional part of the plant binds with your emotional body. This isn't just a physical experience here. That would be selling the Creator short, wouldn't it? Absolutely. You know. But when the kidneys are healthy and filtering, which was the question? Person Y. No, it's what you are filtering that is what matters. Everyone filters, otherwise you would go into renal failure. And that is true, I think, to a certain degree. There is minor filtration for sure, or the blood would get a kickback too. And that's, of course, why they do dialysis. Dialysis doesn't clean the lymphatic system. Hell no. It just cleans your blood, but it strips your blood. Not good. You know, and then they use acids to strip, and so there you go again. I mean, they can use bleach, which is a high alkali, which is about the same thing, really. The question is, are you filtering stagnant lymph waste? Always. Remember, the urine, these systems are closed systems. It's kind of like blood does not have an eliminative organ. It's a closed system. Closed house. Yeah, the only way you have an elimination of blood is when you break a vessel, or you lose connective tissue and you pop, like in an aneurysm or something. Yeah, that's not a way you want to lose that one. But the waste of the body has two ways out. Your digestive waste is through the GI tract. Of course, anything absorbed into the blood then is then metabolized or dumped into the sewer system, and that then has a way out through the kidneys and the skin, of course. But that's after metabolism and all that's broken down. All the undigested waste and things like this are going to go through the pooperino, what is not absorbed into the bloodstream. Anything that's blood absorbed, of course, the lymph system is its trash can. You know, and the spleen is the big trash can for that, if you hadn't noticed. The spleen is both a blood and lymphatic organ because it's how the blood cleans itself. Get it at A&P for Dummies, or get a medical dictionary and read about what these tissues do for you, as much as they know. The kidneys really are not it's somewhat of a blood cleansing, but the spleen is really the big organ for that. And so the lymph nodes are involved, all these things are involved. So anything that you pee out is a product of waste and byproducts of metabolism for the most part, and what the blood's dumping into there as well. That's another problem. Serious chemicals can be dumped into the lymphatic system, and we test the blood a lot. That's why I like hair analysis, a little more accurate in chemistry of the body in terms of toxic chemicals and things like this. The blood's going to dump. If it can, it's going to dump what it doesn't want into the lymph system. There's no other place to dump it, because outside of that you have the cells. And if the blood could dump toxins to the cells, that would endanger the cells. So God wasn't that stupid. So you have a sewer system. It's like in the kitchen. What you don't want goes down the food disposal, and where does that go? Grinds it up and throws it into the septic tank. And then what is in the septic tank? Same thing in your lymph nodes. Bacteria. If you don't understand their role, then you try to kill them. It's like, what? You know, man needs to screw this on a little better. But, don't make a big deal out of filtration other than that. Let's see if there's more on that. No, not too much on that. Let's see up here. Yeah. What you eat has to go through the process of absorption or not. And what's not absorbed is going to go out the pooperino, like I said. What is absorbed is going to be metabolized or dumped into the lymphatic system, which then it requires the lymph nodes, either your carnivore cells, like your neutrophils and macrophages, or your bacterium, or You could also add the fungus community in there, because what you see is fermentation and putrefaction. What isn't metabolized is going to go through some degree of that. So then this is where you get full of fungus and all this sort of thing. And these are just little creatures enjoying what is not being properly metabolized. But then all of that has to be eliminated through the urine. And so you want to filter all of that anyway. But you should be able to filter when you eat cooked foods as well. It isn't about that. Living foods help to keep you hydrated and help filtration at a greater level, especially astringent fruit. But you should be able to filter even eating meats. And that's part of the problem, is that you will filter eating these cooked foods, hopefully, but in time it'll shut down filtration. Just that's what does it in the first place, is high protein diets is what damages and inflames the kidneys. But it also does that to the whole body. That's why protein is one of the biggest myths our society is promoting. It's one of the saddest things that you see. And again, when you go back to mother's milk, protein is the least of the three, by far. Remember, carbohydrates are about 7.5, lipids about 3.5, and protein's less than 1. So you don't see that in life. In herbivores and frugivores, you don't see high protein diets. Even in omnivores, high protein diets will kill your dogs. It'll give them arthritis, tumors, kidney failure, which they already have kidney weakness. So pets should never have high protein diets. But we do that, and it's just a misnomer. It's misinformation. It's a lack of understanding of health and vitality and how the body works. So we fall into that. And so as we damage, we swell and inflame and shut down and agglomulate and acidify. This is called a cationic environment. So we're seeking an anionic environment, a hydrated environment, an environment of fluidity, where things don't get stuck and swollen and compounded, so to speak, agglomerated, like in tumors and boils and cysts and lipomas. And without kidney filtration, you're in trouble. And it's just that simple. If you pee in a jar and it's clear, now I've been asked here if you're going to see sediment every time. I'm going to say no, but I'm going to say you should see it more and more and more and more and more each time. As you move on down the road, different foods will stop you from filtering. You'll see how all this is as you watch your filtration and you eat different foods. That's the beauty of experimentation on yourself, and you've got tens of thousands of people experimenting on themselves too. But the thing is, we've already done this for 40-some years, so we already know what you're going to find. Because I've worked with humans for so many years, I already know where you're going. Because that's where we go. Each and every time. Some of you are advanced. It's going to take a while to work yourself out of it. Don't freak out. Just relax. Pull yourself out of your body. Pull yourself out of your condition. Don't take all these words that medical doctors have told you that you have. Disease this, disease that, this condition. Set them away. Understand that's a dark cloud that only those that breed fear use. Your body's simply made of cells and two major fluids. You hold a little water, but you got cells and two fluids. One fluid feeds the cells and the other fluid cleans the cells. And acts as your immune system. When cells are damaged, they have to be removed. And they're taken to the lymph nodes. And then we remove the lymph nodes because cells are in those lymph nodes that have been damaged. It's like, no. There are problems to all of this, and that's when the kidneys don't filter, everything backs up, and that's when your lymph nodes start swelling. When you feel your lymph nodes swelling, you've lost your filtration in your kidneys to a big extent. And when you start losing the filtration of the kidney itself, that's when you look at your blood and look at your creatinine levels, and your creatinine will show 0.6, 0.7, and you start seeing it go up. Those of you that have 0.7 or above, you're starting to get into trouble. I've got a guy right now that's got almost 0.50. The lab tags it high, and his medical doctor, female, unfortunately, refuses, has not even said a word to him. And I said, you're in deep, deep doo-doo. You're halfway to talking about dialysis. And it's so much quicker to go to the other half. And of course, there's multiple problems with this. And you're going to have multiple problems because when you don't filter from your kidneys and you don't sweat well, you're taking a huge, gigantic sewer system and shutting it down. I will say this. I've watched this a lot of years. No filter, no getting well. Very hard. Now, you can still filter a little bit and not see it. There's no question about that. We still have cases that we get them improved even though they're not seeing a lot of filtration. So don't freak out with that. But filtration is everything. And if you don't filter, hard to get well. And especially for those of you that have tumors. I have a lot. I can say this non-egotistically. I have a lot, and so does Marcy now, a lot of first-hand experience with non-filtration of kidneys and what's on the other side lymphatically and what happens if you don't. So kidney filtration is a big deal. But one kidney can be filtering and the other not. And you still see filtration, but one side of your body could not be getting better at all. But you're filtering. See, so yeah, there's nothing 100%, but it's something. It's something you can grab on to understand. And you keep working and working, so both of them start filtering. And you'll know because the other side of your body will start coming clean again. So it is a big deal to me that you filter your kidneys and get them working. This also means that the adrenal glands on top has to be addressed. I have been raw fruits, little veggies for more than 6 months straight and still cannot see any sediment. That's upsetting. And that's what we see here too. We see some people start filtering within a week or two. I have some a couple of days and their kidneys break loose. And then I have others taking 6 months like this. I might consider the kidney glandular at this time, 2 kidney formula. That's why I'll tell you the honest truth, guys, is why we're using 2 kidney formulas. It's just tough out there now. We're at these chronic and degenerative levels. You're not waking them up as quick anymore. We're even having a hard time. You have 2 kidneys, and one can filter quicker than another, so you could see one side of your body theoretically getting better and the other one not so much. I mean, we see this a lot in here. We have two halves, 2 separate halves coming together, sharing some common ground here. Hello, Dr. Morse. My question is about kidney filtration and water intake. Why is it when I go long periods of time without water, my urine looks darker and seems to filter better? That's a good question. We notice that when people drink way too much water, it cuts down on filtration. So I can't tell you why that is, whether things just hold in there because water tends to be more acidic. But if you're doing alkaline water, I don't know. You should be able to get some filtration out of that. Looking darker, of course, that's when you see your proteins and gnarly stuff in there. So really, even I was watching some of you guys doing some dry fasting, and one of you guys were telling me how much you got out during a dry fast. It was a lot of stuff. So I don't know, I think that doing the whole thing is worth playing up and down and clearing it out. But I've noticed if you drink too much water, things just seem to slow down with filtration. Can't tell you other than just too much water, holding water too much, that sort of thing. It doesn't seem to have very much of anything in it. I was wondering if drinking too much liquid impairs kidney filtration. I was wondering that too. I was, because when you look at other animals, they don't do a lot of drinking. I mean, there was farmers and we had horses, and they do an awful lot of eating before they do a lot of drinking. But you realize grass and stuff like that, of course, has water in it, but not like fruits and berries and melons. Even the primates, they go down to the water once a day, isn't it? Or something like that. I also noticed a lot of kidney herbs are diuretics. And why is that? You know why? The reason for that is simple, that when the kidneys fail, the body starts becoming edemic. It begins acidic first, and then it becomes edemic. It starts holding water. Well, everybody's trying to run to Lasix or some type of diuretic to get off the water. So it makes sense that during this thing, God put a little diureticness in these kidney formulas to help move any stored water out, But they could have more of an astringent action as well, a little more lymphatic action there a little bit. I've been playing around with the idea of dry fasting and its possible benefits. I don't know. I never dry fasted, I'll have to say, that I know of. Maybe a day or two, but never any long-term dry fasting. So I don't know. I don't know. I know Dimitri. I don't know what you do, Dimitri. You did a week or something. You got a ton load of crap out of the kidneys. So I don't know. I know this much, that nature puts you down when if you don't want to fast and clean your body out, you'll get to the point where nature will force you to do it. So, I don't like it when nature forces me to do anything, because generally it's not a lot of fun. So, I'm on board. You know what I'm saying? Do you have any opinion on how much liquid one should consume? Well, this is the thing. See, depends how acidic you are. Because if you're really acidic, you drink liquids. If you feel bloaty after you drink a glass of water, I don't know. That's not too good. It means you're retaining water. And of course, the weaker the kidneys, the more water retention you're going to have. Input should measure output. And a lot of people have higher input than they have output. Where's all that going? Edemic, weight. When your lymph nodes swell, you're not filtering. Something's backed up down below. When something swells up above something, means something down below that is responsible for moving that which is above is blocked, then you're going to see up above swell. And this is true with lymph nodes. When lymph nodes swell, you immediately think, kidneys, am I filtering? Because that's what's up, and that's key. To check your kidney filtration is to get you a wide mouth jar and pee in it. And take a look at that urine in that jar. If that urine is clear, doesn't matter what color, it can be yellow, it can be amber. If it's clear, you have lost kidney filtration. Well, I can tell you already have. Now, you could be picking up some left or right, whichever side doesn't have the tumor on. You could be picking up some filtration from that. But ultimately, you want to see snow in your urine. You want to see a lot of sediment. It looks like dandruff. That's the lymph system. Dandruff is the lymph system. That you want to see you want to see chemistry in that urine. The urine's probably going to be a little whitish yellow, and the white's coming from all the sediment in it. I think most of us have seen times when our urine looked like it was whitish and full of sediment. For men, when they urinate in the toilet, the urine's going to travel toward the bottom of the toilet. Women, unfortunately, are going to have to take a look with the jar. Men should look with the jar, because I did that living in my van. I had a jar, I had to pee in. I had a bathroom in a Volkswagen camper van, so at night I had to pee in a jar, and the next day, throw it and clean it out. I mean, that's what you do when you live in a little van. But I always check my urine. Just that's the thing, what's in there? What's coming out of me? Part of the driving force of getting well. It's all about filtration. Check your urine, each and every one of you. Even you type 1 diabetes, check your urine. Make sure you're filtering. We show this a lot. Thank you so much for the chart. On a raw food diet, your urine can turn alkaline for a while, and I feel that's a great thing God kind of set up, because that'll help to heal the kidneys for a little while until filtration takes place. It's actually how you probably get the kidneys to filter, is keeping that urine a little alkaline while the mucosa and everything, the kick to the kidneys. The alkaline kick back to the kidneys can probably help to create more filtration. So everything is for a reason, and you just have to figure out why that would be. When you see a chemical action or reaction taking place, then you can figure it out when you understand there's a war between acid and base, and if acids win, we're not happy or dead. And so it's just that balance, because it's all just, remember I said life is fluctuation of pHs here in chemistry, and the dominance on the base or alkaline side is essential to have healthy life, and to keep fluids flowing well and filtering well and all that. Just so I understand correctly, Dr. Morse doesn't have any negative precautions or warnings regarding manual lymphatic drainage. Oh, I'll give you one. And or specifically anywhere else on the body. I'll give you one for you massage therapists. One thing you want to note particularly close attention to is that's a parathyroid weakness, especially you rolfers or your deep tissue workers, because, and also with lymph drainage, you want to be real careful about how you deal with the body. You don't need to rough it up. And rolfers, I knew a medical doctor that was a rolfer. She had hurt you bad. The problem with this, and I told you this guys before, we had a beautiful woman. She was retired and lost her husband, and she was just a sweet thing. She worked for us, and she had breast cancer. Well, we cleaned the breast cancer right out of her. And she was, the tumors and all that, and cancer, that's a word the medical doctors like for some reason. And so she's such a lovely soul. We hired her to help us here, and she just became good friends through the years. And then she had a real tough session with a semi-rolfer. And later, well, she didn't show up for work the next day, and so then we sent someone over to her house, and she was dead on the bathroom floor. And my guess is a aneurysm. You know, when you have a parathyroid weakness and your vascular walls are thin, you don't go kneading on a person heavy and hard. I can just tell you, and especially deep tissue work and rolfing, because you can pop. And that, you got to be careful how you work on the human body, because you can't force lymph. And first of all, a massage therapist can't make the kidneys filter with massage therapy. Now, you might be able to definitely assist it with neurolymphatic or kinesiology work, and maybe some assistance with reflexology work from the feet. But if you think you're going to massage and make your kidneys filter, I think you're mistaken. So you have to be careful, because this is a huge deal in the process of taking a human whose lymph system is backed up and getting them filtering and hydrated again. So in massage therapy, massage therapists need to learn this thing, because we used to have a massage school right beside us, beside our clinic here. And every class, she would run them in and have me talk to them. So I'd get them all in here, you know, and I would look at them and say, well, what makes me want to use you guys? I'd freak them right out, you know. And they'd just sit and look, you know, because you've got to understand that most massage professors do not teach the reality of the lymph system. And most lymph books fall right into medical thinking, which is bullcrap. I'm telling you, it doesn't work. And to move acids toward the heart or the inferior vena cava would not be smart. So I'm not so much into lymph drainage work. I'm into neurolymphatic points and the right points, which will then trip the body to drain, not into actually aggressive manipulation of the body. Some is good, no question. I'm not being negative with massage. But I'm saying you be careful when you see a parathyroid weakness. And one of the questions, do you bruise easy? And if you're a massage therapist and you have a patient that bruises easy, be gentle, because you could get yourself in trouble. I just think you have to be careful, and you have to consider many things. You can't just treat everybody the same. Now, with detoxification, we have a hard time treating everybody the same too, and we'd like to. So I think in some cases, I do believe in working the body and kneading the body somewhat. But I like points, and I like to use all these neurolymphatic points, and there's a lot of other points in the body you can use. I like using those points. I was telling you, I had a napropath. He was Dr. Jensen's first original patient, original friend. I mean, these guys were buddies. Jensen would come here to Warm Mineral Springs, which is a highly mineralized spring out of the earth. People travel from the world to come here to this. State bought it, now closed it down. It's like, what? But Jensen used to come here just for those springs and the special mangoes we have just down the way. Best mangoes in the world, I'm telling you. Huge mangoes. Unbelievable mangoes. And they get bigger. You know, some of the guys down there got some major mangoes. But you have to just be careful with digging in too hard on the tissues that are inflamed, that are thin. Connective tissue is thin. You have to be careful, because there's nothing gained except feeling a little better temporarily for the onset. But there are some good massages, no question. They do make you feel good and relax, and it's nice to knead. But true filtration is how you get a remedy from this. And if you do lymph drainage, massage therapists, you've got to learn kinesiology and learn the neurolymphatic points, or move everything toward the kidneys and start working on the kidney points. Inspire those kidneys to filter. And then, because hydration is essential for proper filtration as well. So this is a huge deal when you look at massage therapy on top of what you guys know. So you just have to be caution to the wind in all therapies. But keep your eyes open for bruising easy and parathyroid, because you don't want to happen to your patient, not happen to our friend Susie.